Well, hello everyone. Welcome to the third MOA meeting of the winter quarter. And today we have our lovely guest speaker, Tiana Woolridge, who we will introduce further after talking about the rules and our club. So next up.
All right, before we get into today's meeting, some disclaimers and rules. Please be respectful to officers and our guest speaker today. Please do not ask any diagnostic questions, and then anyone that is disrupting the meeting will be kicked out. And just a reminder that this meeting is recorded and it'll be on our YouTube channel. So if you're not comfortable, you can turn your camera off. Thank you.
So for our agenda today, so for the first one will be the guidelines and club info. So we will spend about 5 minutes of that. Just to remind everyone to be respectful and to not speak over our any of the speakers. So we have time at the end. So if you have any questions, those will be answered at the end. And then for the second part will be the introduction. So our guest speaker, Tiana, will introduce herself and present all her resources. And for the third part will be the Q&A. So that is when you have any questions. So your questions will be answered at that time. And then for the last part will be the outro and our Kahoot, where we will take a picture and have an extra credit Kahoot option. Yeah.
Okay, and I also want to let you guys know that you can earn a maximum of 2 points for today's meeting. So I'll go ahead and send the sign-in form. So sign in the beginning and at the end of the meeting, there will be another opportunity with the word of the day, and that's how you'll be able to sign up. Additionally, anyone who is a member can also participate in the Kahoot, and you can also send us any of your community service as well.
For upcoming events on the 17th, we'll have Seth Suzuki, who is a current physician, and the event might be in person. It's not confirmed yet. And then we don't have any other events in spring yet.
I want to clarify that he's a PA student and it might be in person or online. We'll release more details later. And as always, we have this active opportunities spreadsheet for pre-health students, including volunteer opportunities, scholarships, internships, etc. So if you're interested, you could either scan the QR code or access the link in the chat. But since the link is sent on the chat, I'm gonna move on.
So these are all our social media and ways that you can connect with us. So you can scan the QR code to join our Discord, our link tree, and our emailing list. Additionally, we also have an Instagram and YouTube account. So if you guys want to be informed on the newest information, you can follow us on there.
All right, so for our agenda today, we're going to have introduction and a little background, and then we're going to go to university years and some tips. And then afterwards, we're going to move on to Dr. Tiana's presentation and resources. And then for our last section of the meeting, we're going to have some encouraging words and vice versa.
So we finished the clever introduction. Now we're going to introduce our guest speaker. So welcoming Dr. Tiana Woolridge, who is currently a resident physician at UCSF's Department of Pediatrics. And she's also a college volleyball player. She wrote a children's book and she created a school mental health program. And she'll talk more about this in her introduction. So I'm gonna pass it over to Dr. Tiana.
Awesome. Great. Okay, well, thank you guys so much for having me. I'm really excited to be here and honestly really excited to hear more about what you all are doing and how you're supporting each other. Being a doctor is incredible. It is absolutely one of the best jobs in the world. The training road can be long and hard, but it's absolutely worth it. And it's an incredible experience to get to learn new things every day, to make incredible connections with other people and families and children and older people. and to really be turned to and trusted as somebody who can help heal and provide relief for somebody who's suffering. So huge kind of shout out to all of you for being interested in this field and for being here today and for having me today. So I will go ahead and dive in and introduce a little bit about myself. I'm planning on, talking through a little bit of some slides. I'll give you guys some background about who I am, where I've been in school before, and then I'm going to actually dive into a kind of interactive slideshow that I do around specifically sports medicine. That is the field that I will actually be going into, doing an additional year of training in that after I complete my residency. And so I was like talking to people about some basic concepts in sports medicine and just introducing new people to that field. So backing up and to get started, I'm born and raised in Los Angeles, California. And I have an interesting sort of background. So my family is not from LA. My family on both my mom and dad's side were born in small town, Louisiana. The town's called Mansfield. Almost no one ever knows where it is, but is in northern Louisiana. It was an interesting time. It was a very different time where they were still living under Jim Crow segregation. And so what that means is, there were kind of government supported segregation in terms of not just like schools and colleges and things like that, but even like parks. And so there were like whites only areas of a park or a swimming pool. My mom and dad's first date was going into I hear a little bit of feedback. I'm gonna wait for someone to mute. Wonderful, thank you. The first date that they went on was actually in a movie theater, and they were sitting in this like colored only section up in the balcony, and only white people were allowed to sit on the front row. And I bring all of this up to say, this was one generation ago. My parents are, my mom's my 60s, and I'll talk about more about my dad in a little bit. But it really was this time where Black people weren't valued, or Black people weren't really respected as being, an equal part of society, or, there was this idea that, these folks are separate, or Black people are inferior, and all of these things. And that actually played into healthcare. My mom's mom always pushed education for her kids, and just in general was like, this is the way up, and this is a way to success. And she would always tell me stories of going to the doctor, and there was separate, colored only waiting room and a white waiting room. And as a kid, she remembers all of the white patients would be seen first, and then the Black patients would be seen. And there wasn't really a back and forth with the doctor or kind of asking questions and wanting to learn more. It was like kind of you take what you get. And so to be able to go from that to one generation later, being able to be a Black female physician and to be in spaces taking care of Black patients and like take that extra moment and like listen and really validate what they're going through. That's been something that's really powerful for me, and something that I hold tightly, knowing my past history and my family's history. So I wear that with a badge of pride. I have a different jacket. This is not the jacket, but I have another one that says like Black is beautiful on the coat, and like being able to walk into spaces and have patients of color see that and see that value is really cool. So anyway, that was a long-winded way of saying I'm from LA. My mom and dad actually moved out to Los Angeles because my dad was drafted into the NBA. And so he ended up bouncing around to a couple of different places, but was with the Lakers for a while. And so our family kind of rooted itself in Los Angeles. And so me and my two older brothers ended up growing up in LA, and we were a big sports family. So everyone played basketball. My two older brothers played basketball in college. And then one of them played overseas and in the G League here. And then I switched over to volleyball. I was known as the black sheep of the family, verbatim what one of my brothers said to me, because I dared to switch sports. I switched over to volleyball and ultimately ended up being able to play volleyball at Princeton, which is an incredible experience. My other big interests I bring up, I was always a big reader, always a big writer growing up. I was the youngest child, and kind of there's always a lot of stuff going on around me. And then my mom and dad got divorced when I was about 6 or 7 years old. And so, single mom, I would always be kind of dragged along to anything my brothers had to do. So that was kind of the way I entertained myself and found another world, was kind of through reading. And then ultimately through writing and kind of trying to create my own story and my own way of doing things. And the writing piece, as I mentioned earlier, I did end up writing a children's book. And that book was actually based off of and kind of in honor of my father, who passed away 10 years ago this year. And so, or last year, 10 years ago last year. And yeah, it was just a way that I was able to use something I really cared about and was passionate about as like a healing tool as I was going through this grieving process. So happy to talk about that more offline if anyone is interested in that. And then lastly, I'm super into mental health advocacy for a handful of reasons. So first, my father actually had a substance use disorder while he was playing professional basketball and had to go to rehab. And there were a lot of things dealing with that. And my mom has depression. And so it is very important to me, and it was always important in my family to have open conversations about mental health. My mom from a young age was very open about these are things that happened in our family. And I totally thought that was normal. I thought that was what everyone's family did until I got a little bit older and started having more conversations with my peers. And they were like, oh my gosh, you guys talked about that. And I realized, again, especially for Black and brown couples and our families, for immigrant families, like it is just mental health is not something that's really discussed. And so I was really, people can talk about, oh, you had parents with mental illness, like that's really unfortunate. For me, I see that as a strength and something that's really fortunate because that is something that opened up a lot of those conversations around mental health at a young age. And so when I started developing kind of signs of depression when I was in college, my mom was able to kind of pick up right away on what I was going through and was like, hey, maybe you should go see therapy. And I was like, oh my gosh, yes, let's do it. And that really helped turn the course for me. And so I do a lot of trying to teach and provide information and knowledge for young people around mental health so that they are able to take that step to understand when they need support and what kind of support is out there. And so that's a huge part of what I do, kind of inside and outside of the hospital. I see all these comments popping up, so thank you so much. These are awesome. My mom's great, family's great, and thank you for the support. And so I was one of those kids who wanted to be a doctor really ever since I was a little kid, like 6 years old. People are like, oh, what do you want to be when you grow up? And I wanted to be a doctor. And I know some folks can probably relate to this. And I, love science growing up. My mom also, again, having grown up in this like small town community and having not grown up with much money, she always emphasized the importance of helping each other and how she never felt like she was lacking anything growing up because the community always helped each other. And so that was a very core value for us, was like, whatever you do in life, like you need to help somebody else. And so, the science, helping people, medicine, all sort of made sense. The other part of it too was I was diagnosed with scoliosis when I was a kid. If you guys know what it is, feel free to Google it or something and then hop back in. But I essentially had to wear a back brace for, from when I was 12 years old to 14 years old. And scoliosis family in here. It was awful. You think about a 12 to 14-year-old girl, like, already dealing with self-conscious body changes, all the things. And so that is the absolute worst time to like tell, okay, wear this giant plastic back brace 22 hours a day, like at school and everything. And I unfortunately had a doctor who was like his bedside manner was not the best, I will say. And he just completely ignored my pain, completely ignored the kind of frustrations that I was feeling with this treatment and all that. And was just like, you have to wear it. And if you don't wear it, you're going to have to get a surgery and it costs $100,000 and your mom's going to have to pay for it. And then he proceeded to show me pictures of the surgery and what it would look like with somebody's spine fully cut open and like rods in their spine. Luckily, I wasn't traumatized. Luckily, I was like, this is really cool and I'm going to do this one day. And I also didn't wear the brace more, so his plan totally failed, but it all worked out for the best. So again, between my early life experiences, my own personal interaction with the medical field, and my kind of family history, there were lots of reasons why I wanted to go into medicine. So ultimately went to Princeton for undergrad. I went straight from undergrad into medical school here at the University of California, San Francisco. We can go back. Sorry, two more real quick. And then graduated 2020. Check me out on Instagram. Yeah, okay, we could go back. I just wanted to make sure I wasn't missing anything on there. So it went straight through from med school, graduated 2020, and then started residency after, and now I'm at the end of my residency. So to break it down a little bit more, I also love whoever put this little tiger on there. That's very adorable. I went to Princeton. Oh, thank you. I went to Princeton University. It was an incredible place to be. So I was a legacy, if you can call it that. My brother was actually the first in our family to go to Princeton. I also want to like huge shout out that like my mom, on my mom's side, her mom and dad didn't have beyond like a middle school education. I think she said her mom might have gotten some middle school and her dad, it was really like 3rd or 4th grade. And then he had to go start working to support the family. And so they went from that, like one generation, next generation, to like 2 kids in the Ivy League school, and all this played Division I sports. And so again, huge shout out to my mom and huge shout out to my ancestry in that way. Yes, period, all of that. So it was really, really an incredible experience. I started in 2011. I'm dating myself now. And I had visited the school before. I was really excited to move 3,000 miles away from my mom. As much as I love her, she was very much, you know, no pun intended, a tiger mom in that sense of like, you study, you don't go to parties. Like this is going to be your life. Study, go to school, sports, study. And so, yes, I was like, let's get on this plane and go across the country. I went into undergrad thinking like I have to do something in science. And so I originally signed up to do molecular biology and then quickly realized that was not for me, even though I wanted to be a doctor. Yes, when they track your location 24/7, exactly. I realized molecular biology wasn't for me. Like I did love science, but my interest in science and in health was on a larger scale. So thinking more about how people thought about healthcare, how people understood their own health, how governments kind of dispersed healthcare resources, how people dealt with global disease outbreaks. We actually had an outbreak of meningitis when I was a junior at Princeton. You guys could probably look that up too. Like if you look at Princeton meningitis 2013, like you'll find all that crazy information. We had like a mass vaccine campaign that we had to do because it was like a different strain that pops up and is prevalent in Europe, but not here. And so it was like it was actually really cool. I was able to be a part of, as part of the Student Health Advisory Board, I was part of that like vaccine movement and that kind of public health communication movement in the face of this epidemic that was happening. So yeah, the extracurriculars I did volleyball. I was on the Student Health Advisory Board, where we largely did things around, health weeks and teaching around, I don't know, like sleep and mental health and like safe sex and like safe drinking and like all the college health sort of things. But then also when the meningitis outbreak popped up, we were like very, very involved in that. I was part of an awesome organization you guys should definitely look up later called the Foundation for the International Medical Relief of Children. They sponsor a lot of different sites all over the country, different children's health sites where they have volunteers and clinical staff working to provide medical care for underserved folks all over the world. They also have like high school and college graduate programs and like educational programs. And so what I was actually able to do at Princeton my freshman year, me and a couple of other folks did various things to raise money for a clinic and raise donations, gathered different donations, toiletries and whatnot for one of the clinic sites in Costa Rica. And then at the end of the year, 3 of us actually flew to Costa Rica and spent a week working in a clinic there. Like shadowing the doctors there and like helping out in the clinic in various ways. So that was one of the most awesome experiences that I had in terms of pre-med experiences. They do offer virtual and in-person experiences. So again, would definitely look them up if you're interested in global health. And then lastly, really involved with service. So the Student Volunteer Council was something that I loved being a part of, not only myself being able to get involved with community service in undergrad, but also helping my peers at Princeton get more involved in service. So those were all really cool things and ways I helped build kind of my leadership experience, my medical exposure, which is really important applying to med school to show that you've actually spent time in that medical space and you kind of know what you're getting into and that you like it and you're interested. And then again, showing that leadership in various ways. And so after undergrad, I went straight through to medical school at UCSF. You can go to the next slide here. So these were sort of what this pathway looked like. So I was somebody who, again, knew that I wanted to go to medical school right after college. I was like, everything I've done has prepared me for this. This is what I want to do. I didn't have any questions about maybe do I want to do a different type of health profession. And so this track started very early in terms of application. I had some friends who actually had to take a year off of school in between like graduating college and starting medical school, not because they really wanted to, but because they didn't realize how early the application process started and how like soon you have to be on top of like putting your application together. And so kind of that forced that extra year off. And so I always encourage folks to like look early, and it sounds like you guys have lots of resources around this, but I really started, studying for the MCAT and started preparing the different components of my application when I was a junior in college, and submitted the first part of my medical school applications, like the second the portal opened in June of like right after my junior year of college. Because that's important, like med school admissions, it's like really, really hard to get into medical school just because the admission numbers are so low. And so the one thing that you can control is applying as early as possible. And a lot of people are like, oh no, I can apply whenever. And I'm like, no, like as soon as the portal opens, apply. Like that is the one thing you can control. And all these schools are on rolling admission. So the later you wait to apply, like the more other people are like getting offers and getting accepted. And so I actually I applied to, I think 15 medical schools and I got accepted to 3. And these are the 3 I got accepted to. Thank you. And I got these acceptances in December because again, I applied like super fast and then was able to, once I got the secondary applications within 2 weeks, I made sure I turned those back in. And so again, the speed with which you can do this stuff really does help. I ultimately decided to go to UCSF for lots of reasons. One, UCSF is really, really powerful and well known in the medical community for having a lot of strengths broadly. So every department you can think of, whether it's primary care, whether it's surgical, whether it's research, whether it's biotech, like UCSF's got the top of the top people. And so that is really a strong reason why I wanted to go to UCSF. I also love the Bay Area. I loved, Los Angeles isn't really known for being like a very like advocacy, like activist city. And so I was very intrigued by that, this idea that people really, really cared about, that they really, really cared about what was going on in the community and how that affected people's lives and affected people's health. So again, was really, really excited about UCSF. I graduated in 2020. Some of the things that I did when I was at UCSF, SNMA was awesome. Every medical school has different sort of affinity groups for people of different races, ethnicities, gender, sexuality, things like that. And so SNMA was the group for Black students. And so I was like deeply involved with that. I was a president there and a like regional chapter board member and things like that, which was fun. And then again, I was really interested in kind of musculoskeletal surgery because of the attempted traumatic tactic that my old doctor took to try to get me to wear my brace. Really got me interested in orthopedic surgery. And so I dove right in, even as a medical student, was connecting with mentors. I would go to a talk about orthopedic surgery and like go up to that person after and be like, hey, this was great. Can I shadow you? Do you have any research projects going on? Like, what can I get involved in? That's something I would definitely recommend for all of you. Whenever you go to talks, whenever you meet people in person, just like dive in and ask for different ways you can get involved and get to know them more. And the other thing that I did, which is actually becoming more and more common, is that a lot of people will take a year off in between their 3rd year and their 4th year of medical school and either do research for a year or get another master's degree in something else. And so there was actually about a third or a quarter of my class did that after my 3rd year in medical school. And so I actually went and got a master's in public health. For UCSF students, they usually will either get a master's in public health from Berkeley or from Harvard. For whatever reason, it just ends up splitting up that way. And so I ended up doing the master's program at Harvard and I got a scholarship there, which helped a ton. And that was actually when I built this school-based mental health program, which was an awesome experience. Again, a whole nother tangent for another day. But the public health degree was really, really cool because I was able to really think about like, how can I go from thinking about fixing one patient in front of me and fixing this one person's health to try to improve health on a broader scale. And so the master's in public health really gave me the tools and the time to be able to focus on that. So graduated in 2020 and I went right into pediatric residency here at UCSF because I love the people here. They say UCSF really stands for you can stay forever. And so I took that to heart and stuck around. And so pediatric residency is a 3-year program. Residencies are either 3 years up to 7 years. And so mine, fortunately, is just 3 years. And then after that, I'm going to do 1 additional year of training in sports medicine. So in addition to being a board certified pediatrician, I also will have this information, this knowledge in sports medicine. All right, let me go to the next slide here. Cool. All right, so that's a great transition into me sharing my screen and talking to you all about what sports medicine is. So let me do that and Wait, where am I?
You
There we
can
go.
click the slideshow. Yeah.
Perfect. Okay, cool. So I'm going to go pretty quickly through this because I want to make sure, like probably like 15 minutes max, because I want to make sure that there's plenty of time for questions. But this is how I give people a bit of an understanding about like what sports medicine is and what are different ways anyone who is interested in sports or just in the musculoskeletal system can get involved. And so what is sports medicine? It encompasses a lot. It talks about, not just injuries, but physical fitness, prevention of injuries. And it's really now considered a distinct field of healthcare. And there's lots of different people who are involved in sports medicine. So of course, orthopedic surgeons, but what I learned and was really excited to learn about is that you don't necessarily have to be a surgeon to be involved in sports medicine, because there are plenty of non-surgical things that happen in sports medicine. People can sprain an ankle or break a bone. They don't need surgery. They just need to be followed. They need to do physical therapy. They need to be followed by a doctor. They need to make sure the fracture is healing. But you don't have to be a surgeon to do that. And there's also other things like concussion management. So somebody gets a hard hit on the head and they're out for a couple of days or weeks. We can help manage that. And then things like cardiac issues, heart issues, chest pain issues, asthma. There's all sorts of things that primary care doctors have specialized kind of training in that translate over well to sports medicine. And then these last four are things that are not medical doctors, but they're other fields. So if there's anyone out there who's like I'm interested in medicine, but I don't know if going the medical the MD or DO route is for me. These are other options too that have different kind of levels of the amount of training that you need to do. So for athletic training, that's usually like an additional year after college. Physical therapy can be kind of a range in terms of how far you go, but usually it's like another kind of 4 years after college, but you're focusing specifically on physical therapy. Certified personal trainers, so those are people who kind of focus more on strength and conditioning. And then sports psychologists, which is a whole cool other field that exists, where they're able to kind of work with athletes on their mental health. And so these are the kinds of things that I will be dealing with. And then since the chat has been pretty active, I was like, I feel like we can keep just using the chat for the interactive portion on this. And so these are the kinds of things that as a pediatrician I've dealt with before, but especially as a sports medicine doctor, these are things that I will, that will be referred to me and things that I will have to manage. So 16-year-old female soccer player comes to your office with a non-contact injury to her left knee. She was quickly changing directions to chase down a ball when she felt a pop in the knee, followed by immediate pain and swelling. Her athletic trainer gave her ice and an ACE bandage. 4 days later, she still has pain, continued pain and swelling, and feels unstable on her leg. Anyone have any ideas? Can you drop in the chat of what this could be or what could be going on with her? Did she, I love it. That's a start. That's a start. AP knowledge isn't coming through. And think about like if you, love it. Okay, people said ACL, MCL, LCL, a tear. Yeah, so think about like ligament injuries. What else is in your knee? Like what are other things that can go wrong with a bone? Someone said cap, which I don't know if they just mean like someone's lying or they're actually, that's an acronym for something. All right, patella pop. Yeah, totally. You can fracture a patella. That's like your kneecap itself can totally happen. So yeah, you could, whenever I think about a joint, I like to think about muscle, bone, ligaments. So thinking about your muscles, could you have a muscle sprain? I feel like a resident being questioned. That is how a lot of medical stuff works. There's a lot of like thinking, active thinking through answering questions and kind of walking through your thought process. So thinking about muscle. So did I have a muscle strain or did I tear a muscle? Thinking about the bones, did I fracture a bone, like take a chip off of a bone in some way? A tendon or a ligament, so something that connects bones to bones or a muscle to a bone. Did I sprain that or did I actually tear it? And so great ideas. So in this case, again, there's a ton of stuff in the knee that could be impacted here. And so we talked about, again, is it something with a muscle? So the quadriceps, hamstrings, back here you have the gastrocnemius and soleus, the calf muscles. Thinking about the bony issues. So you have 4 bones coming together at the knee, your femur, your thigh bone, your patella, your tibia. So like your knee kind of is making up that top part of the tibia, and your fibula here. And then thinking about your ligaments here, you have your patella tendon, patella ligament. You have somebody had mentioned the LCL and the MCL, so your medial and your lateral collateral ligaments. So you've got here, this is the lateral collateral, and you can't see, but on the other side is the medial collateral ligament. And then thinking about different things, like we didn't talk about this specifically, but the meniscus is like this cup of cartilage that sits on top of the tibia that provides a little bit of cushion, so you're not having bone on bone where your femur is coming right on top of your tibia, which causes a lot of pain. And that's what osteoarthritis is, when you have that wearing down of cartilage and you get bone on bone. That can be very, very painful. And that's a reason why a lot of people older folks will need a knee replacement to fix that issue. So lots of different things that could potentially happen. And then if you look even closer and kind of start studying things a little bit more, and all of you guys will learn this in medical school or whichever health profession you go into, there's tons of more structures as well once you start thinking about what's inside the knee. And so somebody brought up the ACL. So again, the anterior cruciate ligament. This is like a ligament that kind of crosses the inside of the knee joint to provide stability. So your leg can't go like this or like this, but it keeps it stable that way. You also have like a fat pad in the knee that could, if your bones kind of hit together, that can get pinched and really inflamed and angry. And you have all these different spaces that can also kind of get chipped off, or they can just get irritated and inflamed and angry as well. So it gets complicated quickly. We use lots of different imaging methods to try to figure out what's going on in addition to our exam. And so back to our patient and kind of explaining what we're seeing here. This is an MRI, a magnetic resonance image, and we're seeing a couple of different slices of the knee. And so in this part of the knee, what we're looking at is if you were to sort of cut the leg in half. So I will say, if you cut the leg in half like this way, and then looked at the MRI, basically what you would see here, you're looking up here at the femur. This is the patella, the knee bone, and this is the tibia. And so what you can see also really, really well on MRI, X-ray is really good for looking at fracture. So looking at, are the bones in one place, or is there a crack or a separation in the bones? And MRI is really helpful for looking at lots of other things, including your tendons, looking at your muscles, looking at swelling, all that kind of stuff. So you can see really, really well, which you wouldn't be able to see on X-ray, your patella tendon coming down over your femur, crossing over your patella and attaching down over onto your tibia. You can see the muscles, so you can see some quad here, you can see some hamstring back here. And then what you're looking at inside, what you would want to see is a really nice black X kind of going through here and here. And that is your ACL, your anterior cruciate ligament, and your PCL, your posterior cruciate ligament. And they sort of cross in your knee to provide your knee that stability so it doesn't slip back and forth. And so what you guys are seeing here essentially is that you have this area where there's a gap in between. And so there was a rip. See, there's like a little fragment of tendon over here, a little fragment down here. So there's a rip in that ACL. And so that is what an ACL tear looks like on MRI. Other things that you can see on here, this is another image. If you kind of cut your leg in half the other way, so if you kind of cut it, and so you were looking at slices of it head on. And so again, this is your femur, and then this is your tibia. And so what they're showing here, again, you should be able to see an X, a crossing of those ligaments, and you're seeing a gap here. So you see some tendon up here, some tendon down here, and there's a tear. And then what these are showing are some like bone bruising. You can get some like lighter patches here, like bruising and swelling. These are areas of like swelling, like this bright stuff shouldn't be here. These are all things that can happen to kind of point you to, okay, I think there's like swelling, there's injury, this tendon has been compromised. And so the other way that you can see, or that I start thinking about an ACL tear, is called the mechanism of injury. So how did the injury actually happen? Like, how did the bones move? And do I think the way that the bones moved led to a certain type of injury? And so for an ACL tear, we think about something, a non-contact pivoting injury. So meaning that like two people didn't come into contact with each other or hit someone, or you hit a wall or whatever, because then we might think more about like, okay, did someone break a bone because they have this like physical force that hit them? But we think about a non-contact, somebody was trying to pivot, and as they tried to pivot, the bone slid too far out of place and caused a tear in that ligament that was holding these bones together. And so that kind of pivoting, like pushing off in one day, caused that tendon to rip there. And then there's also often damage to the meniscus or to those ligaments on that side, which you can imagine, right? If you had something holding on this side and across here, and you ripped off this way, there's likely going to be some tearing here as well, and could be some damage to that cup that sits on top of the tibia here. And so often what you'll see is someone will feel a pop, deep knee pain, and immediate swelling. It's actually possible to treat an ACL tear without surgery. And so again, you don't need to be a surgeon to manage these things. For people who are older and who won't be necessarily running and cutting and pivoting, you don't have to treat it with surgery. And because there are, just different ways in which that you can just kind of stabilize the knee and strengthen the muscles around the knee to avoid the risk of surgery in older folks. But of course, for, you think you're high level athletes, stuff like that, then you're really going to want to reconstruct that ACL or repair that, not really repair. So basically the difference between repair and reconstruction, repairing is taking those broken ends and stitching them back together. But doing that for the ACL is shown to fail a lot. And so it's not something that's commonly done. They will just reconstruct it. So essentially they'll take a tendon from somewhere else, either from somewhere on your own body. So from your hamstring, because there's kind of additional tissue you don't really need as much. Or they'll take it from a cadaver. So somebody who's passed away and donated their body to science. It's better to use your own tissue because there's a risk that your body will kind of see tissue from somebody else as foreign and try to attack it and get rid of it. And it's, if it was from dead tissue and whatnot, it may not be as healthier and alive. But anyway, so you take that tissue and you basically create a new tunnel through the bones, and you put that new tissue through the bone. And then you spend many, many, many months rehabilitating and getting your body to get used to the new way that it is functioning. And so again, for the visual learners out there, I'll only play a minute or two of this because everyone just freaks out when they start showing this, because it shows a lot of people tearing their ACLs. And so it's just oh God, oh God. But I find it helpful because I just explained a lot about how the mechanism of injury can happen, but this is helpful to kind of see it. So you can see here. Okay, so you can see there's that stretch kind of thing that happened right before he paused. There's another one you can see here. They'll slow it down and kind of show you.
You see the burst.
That see how that straight leg kind of twisted out there.
He didn't even take off. Once he planted and tried to.
Concerns with that right leg, what happened there?
No, I'll be good.
And so yeah, lots of different things. It's often with that planting, with that leg in a uncomfortable and unnatural position that causes that stretch on the leg there. So that can be pretty tough.
Grabs his left knee.
I know. I hate seeing people in distress like this. So
And a lot of quick.
all right. So lastly, you can see that same angle, that really awkward angle.
You see that left knee.
I know.
leg
Yeah.
walking
Yeah.
a bit, even
All right. I don't have to force you guys to another minute of this, but as you can see here, those are the mechanisms of how some of those things happen. All right. So the way that you would treat something like this is what the acronym that we like to use whenever anybody has a joint or a bone or anything that's really painful all of a sudden is RICE. So R being rest, so stopping the activity that you're doing. I being ice, so putting ice on that extremity for 15 or 20 minutes a couple of times throughout the day. C being compression, this idea that once you have an injury specifically to a joint, you'll often get swelling into that. And so you want to help provide some compression to kind of get some of that swelling out of the area. And then elevation with the same idea. If you elevate the extremity to higher than the level of your heart, that'll help with kind of getting some of that swelling back out of that joint. For an ACL treatment, you do quite a long period of prehabilitation. So before you get surgery, doing some stuff to reduce swelling and improving range of motion. Then once the swelling is down enough, ACL reconstruction is done. There's just studies showing that if you wait a little bit longer when swelling is improved, there's better outcomes of the surgery and less risk of it failing. And then doing kind of this 4-week period of locking the knee out straight, and then a multiple month period of starting physical therapy with stretching, strengthening the hamstring and the quads, those muscles around your femur, and then return to sport after a very, very long time of rehabilitation, so about 9 months. And I'll quickly go through this because I know we're coming in about time, but this is something that I actually used to talk about, starting a year or two ago, and the Damar Hamlin thing happened. Unfortunately, thank God he's okay. where this case of a collapsed athlete. And so this is another thing that sports medicine doctors will be at the sideline of a medical game. Athletic trainers will be there as, or a medical game, of an athletic game. You'll have your athletic trainers there, you'll have your sports medicine doctors, and there may be somebody kind of out there running around and all of a sudden just stop and collapse and they're just there unconscious. And so what do you guys think, and I'll just take a minute for this, what are different reasons that someone may just like pass out like this unexpectedly?
Could it be from dehydration?
Totally, yes. So basically our bodies are mostly water, right? And so most of our blood is water. And so if you don't have enough water in your blood and you don't have enough like kind of blood moving around your body, you can't get enough blood to your brain to keep you awake and like functioning. And so if that happens, then you pass out. And part of the reason it's helpful and that we like evolutionarily, we've like developed that thing of like, okay, I don't have enough blood in my brain, I'm going to fall down, is because when you're flat, you actually can get better blood flow to your heart, or from your heart to your head, because you're not fighting against gravity. Because the way I'm sitting right now, my blood has to fight against gravity to get up to my brain. And so if you're horizontal, that's easier for that blood to get there. So yeah, great suggestion. All right, so dehydration, exhaustion for sure is kind of similar kind of idea. Blood pressure drop, exactly. So all those things could be connection. If you're dehydrated, your blood volume, there's not enough water and blood kind of flowing around. And so your blood pressure goes down and then you pass out. Totally. Does anyone else know about the Tom Hamlin thing that happened? Kind of what do people know kind of what happened to him, or what other organs can be involved and a reason why people pass out? I think I heard someone say something earlier. Okay, well, I'll dive in again, given time. So lots of different reasons that can cause somebody to pass out. And so the biggest thing that we worry about as sports medicine doctors that we want to rule out right away is their heart. So did their heart stop beating, or did their heart start beating in a way that didn't allow for blood to get to the organs in the right way? And so heart conditions is the big one that I'll talk about. Heat illness. So again, if it's too hot, you're sweating too much, you're not able to cool your body down. Anaphylaxis, less likely on a basketball court, but if somebody like threw a peanut in someone's mouth on the court and they like had a reaction. Vasovagal is kind of getting at like that. If somebody like scares you all of a sudden, or if you hadn't been eating much this day and you go from sitting to standing up really fast and then you pass out, that kind of stuff. Being dehydrated, of course, different drugs or toxins if somebody was using certain things or exposed to certain things. Having low blood sugar, so we really worry about that with our athletes who might have diabetes. Seizures, so of course if somebody has a seizure all of a sudden, not everyone who has a seizure like does all of the shaking. Sometimes people have a seizure where they just drop to the ground and they're unconscious for a while. Hyperventilation, so if they were breathing really fast or panicking, that's why people, when you're panicking and you're like, people like really are like, okay, slow down your breathing, take a deep breath, because if you do that for too long, you could actually pass out. And then narcolepsy, I won't get into it, but that's also another cause why people may. Narcolepsy is when you have a condition where you have issues sleeping, and you can actually have a lot of daytime sleepiness and kind of fall asleep at the drop of a hat during the day. And so there's a video here. I won't show it given our time, but it talks about how people first respond to somebody who's passing out. We always like to think about like the ABCs, thinking about your airway, breathing, and circulation. Whenever I go into any emergency situation where somebody may be on the ground, not talking, not breathing, I have to think in my head, okay, what's a way I can step-by-step go through this so I don't leave anything out, and so I know what to do instead of just panicking and be like, oh my God, there's a person on the ground, what do we do? And so you really want to make sure that the person's breathing first. You can put your chest, even if you don't have a stethoscope, kind of put your ear to their mouth. You want to check a pulse. And, you can check a pulse here, and you guys can feel that on yourself. Your jugular vein, you should feel something kind of pulsing there. Your carotid arteries, you can feel those things kind of moving and pulsing with you. And if somebody doesn't have a pulse, you need to start chest compressions right away. And so that's super important. Learning how to do CPR is an amazing way that you can save a life even before you go into medicine. And then you want to get something called an AED. And I'm just skip this for now. This is also something that can be super life-saving. So I don't know how many folks have seen an AED before, but this is an automated external defibrillator. These should be in like any public building, airports, train stations. You could start kind of keeping an eye out and looking for these if you like see them on a wall anywhere. But these are things that essentially you could stick onto the chest. They have all the instructions on there, and you're able to assess what's going on with that person's heart. So it can actually read a heart rhythm, read if the rate is too fast or if the rhythm is irregular, things not working the way that it should be. And it can provide a shock to try to reset the heart rhythm. And so it's a really, really cool way, again, that any bystander can save a life. And that's something that actually happened in a football game. For those of you guys who don't know about what happened to Damar Hamlin, he was in a football game, collapsed unexpectedly. They had to do CPR in the field and defibrillate him in front of like millions of people watching. And so really scary, but luckily people who knew what to do were on site and saved his life. And he is alive today due to people's fast reaction to him passing out. And so I will end there and stop sharing and turn it back over to whoever was sharing the main PowerPoint, and I can give my kind of closing words, and then we can open it up for any questions.
Okay, thank you. I will do that real quick. It's like kind of lagging, sorry. Let me do that real quick.
I love
okay.
the Dr. Tiana in the next Super Bowl. Maybe, we'll see.
Okay, so now.
Yeah, now for words of advice and encouragement. And also just a side note, I think Dr. Tiana's story is really beautiful. Background and everything.
Thank you, really appreciate that. Cool, so yeah, so these are my 3 things that I would say if I could do it again. First and foremost, and I hope this is like a huge takeaway that you all take, is pouring into your mental health, taking the time and space to take care of your mental health. So many people have mental illness. It is so much more common than everyone thinks it is. And even if you don't have a mental illness, your mental health is something that could be good or bad based off of, your self-talk. If you talk and think about yourself negatively or positively, the way that you deal with stress, the way that you connect with others. So definitely, I attribute a lot of my successes to times that I recognized that I wasn't doing well mentally and like was able to connect with people, connect with therapy, take antidepressant medication, all of those things. I currently take antidepressant medication. So yeah, I just love being very vocal about these things and normalizing these things because it's so important. And the more you're able to take care of yourself, the more you're able to take care of other people. And I mean that literally in the sense of like, I'm a better doctor when I am mentally healthy. And I can also share those connections and those stories with my patients and kind of give them the tools that I've learned along the way of taking care of my mental health. I'm able to give that to other people. The next thing that I will say is developing relationships with professors and mentors. This is huge from like a straight up resume building, being successful perspective, especially when I was in college. I feel like I had this like fear of my professors or like this distance that I created where it's like, I'm the student and I'm in my class and they are like this adult person who like, I can't really interact with outside of just being in class. And what happens that when you are applying to medical school, you need a couple of letters of recommendation. And so like, you really don't want to get letters of recommendation that are super broad. And they're like, they were in my class and they got a good grade, I think, but I don't really know who they are. And so the way I kind of scrambled and did it my junior year, it would have been a lot less stressful if I did this earlier, or if I knew to do this kind of sooner. But I essentially started going to office hours more. So really like once a week or once a month, I would go to office hours. I would make sure I had a good question to ask. I would make sure that, I was like, okay, I had this question about the homework, or I wanted to understand more what you said about class. Or like, I would do some optional reading and like be like, oh, well, I noticed in this reading, and they're like, ooh, they're like, are doing the optional reading, like amazing. And so you need your professors because you need letters of recommendation. And so it's a really good way to not only like develop that relationship where they're like, they care about my subject matter or the subject that I'm teaching and they want to be better, but also it shows that like initiative that you're like taking charge of your own learning. And it shows that sense of like, okay, I'm going to spend more time with this person and get to know them as a person. So asking them like, why did you end up going into this field? Like, where did your interest in this topic come from? Like, just getting to know them more as people can be helpful too, because then those questions will come back to you and then they can get to know you a little bit better. And then lastly, I mentioned this earlier, but I really want to get this point across too, is to get organized and prepare to apply early, like early, as soon as those portals open up, try to submit your application, because that is like one of the very few factors, like when you get to that point of your applying, that's one of the very few factors that you can actually have an impact on. And so those are the three things that I would say are my big takeaways. If I could do it again, I would like really lean into all of those three. And yeah, I'm excited for all of you. I'm excited for the future. I'm excited for what you guys have ahead. I know it feels like a grind and stressful at times, but it's all worth it. Being a doctor is an amazing thing. So I will leave it at that.
Okay, so now we're gonna take a picture. If you like to be in the picture, please turn on your camera, and I'll take a picture in 20 seconds. So I'll give some time for you guys to turn on your cameras. Okay, ready? 3, 2, 1, 3. I'll take like 10. This happens every time. Just one more. Okay.
I love it.
Okay, now we have like a few minutes for a really quick Q&A. So if you have any demanding questions that weren't answered, please ask in the chat. If not, I'll start with my first question, which is, I always ask this to every guest speaker, and especially since you're so big on mental health, how do you deal with burnout, and what are ways for you to cope with it? Because you were in medical school and you're in residency, and now you finished all that. So I'm pretty sure there are hard moments out there, and there are some moments where you feel like you're gonna give up, you want to give up and stuff like that. So how do you usually cope with that?
Oh my gosh, such a good question. And I really appreciate you asking that. I would really say leaning into the tool that I have developed over time from therapy and whatnot, that are really helpful for me for improving my mental health. So one is meditation. So I am a huge fan of mindfulness. I use the Calm app every morning when I wake up. They have like a daily guided meditation they do. They also make you kind of track your emotion. They make you track your 3 things that you're grateful for. And so reflecting on what you're grateful for every day is actually like scientifically proven to improve your mental health and your well-being. And so that is something I definitely would encourage folks to do. And then leaning into my connections with other people. Like often when I'm feeling really tired and burned out, we all have a tendency to kind of isolate ourselves, where it's really that human connection that helps remind us of, why the work that we're doing matters and why being in medicine matters. And I think lastly, leaning into those really meaningful moments with patients and just remembering that, like, yes, there are sad moments, there are difficult moments, but this is like a really unique and special thing that I get to do, being in a patient's life and in a family's life when they're most vulnerable and they don't know what to do and they don't know what's going on. And so really just reflecting on the gratitude of, like, I have these people here who quite literally trust me with their lives, and they trust me with their children's lives. And there's something really beautiful about that. And so again, just really trying to lean in and connect. And I'm going to try to answer all these questions that popped up in the chat really quick. Okay, so let's see. Have I ever been asked to give a diagnosis from a friend or family member? All the time. This will happen to you all the time when you're in medicine. I will get pictures of random babies' rashes, or like, it happens. So be prepared. Had to prescribe antibiotics to be like friends and family. So yeah, it's part of what we signed up for. What study technique worked best for you in medical school? Did you use Anki? I actually never used Anki. I wasn't a big like flashcard person. I really, really liked writing things out on a whiteboard with people, and like doing the teach and teach back kind of method. So kind of sitting down and studying, reading over the material, and then having to like explain it to somebody else. That was really, really important to me. And that was a really helpful way. And so I'm going to have to run in 5 minutes, but that was a really, really helpful way to, like, you learn something the best when you have to teach it. And so like being able to have to like force myself to like wrap my head around something in like yeah, was really, really helpful. Let's see. Oh, and then when it came to actual test time and like, especially standardized testing, lots of practice questions. Like the best way to study for a test is like recreating the test conditions. So big practice question person. How did I participate in a lot of extracurriculars? Yeah, so organization, time management will be the biggest thing that you need, not only in college, but in medical school and as a doctor. There's a lot of material to know. And especially when you get into later years of medical school, you're not only learning new material and taking tests, but you're working and like you're in the medical space, doing rotations in the hospital 8 to 10 hours a day. So being able to be very, very organized, getting a planner, scheduling out your days, getting used to that will really help you a lot. And so again, I was just like super excessive with planning. Like on a Sunday morning, I would sit down and plan the whole week and slot out times for studying and times to do X, Y, and Z. And so that was helpful. Advice on landing research positions, internships, connections, honestly, like talking to people as soon as you meet new people in these kinds of events, when you meet new people. My health professions advising office at my college was also really helpful in terms of helping me figure out opportunities. So using your college advising office, career advising office, all of those things can be helpful. And remembering you don't have to necessarily do the same thing everyone else does. So research doesn't have to be, I go into a lab and I pipette. Research can be things like I, went into a specific kind of setting and I was doing like public health research, or I researched on like vaccine rates, or I did research on mental health and on therapy. Those can be super helpful too. And then actually, can you guys give me 2 secs? I'm just gonna like walk out of this room and walk to the outside because there's somebody who's like keeps knocking on the door trying to get in. So 2 seconds, I'll be right back.
Oh my God, I'm so tired.
Same. I feel like that's every single day though, but it's whatever.
I feel like whenever we meet, we talk about how we are, which is tired, how tired we are, how tired you are, how tired.
All right, folks. So about to wrap up here. I will say that I'll answer the last question of handling a stressful day of being on call, and then I will peel off. And then feel free to again follow me on Instagram, DM me, like happy to answer more questions, and I'll drop my email in the chat as well. But I would say it's again trying to lean into the little moments with patients. And so not just going in and thinking like, oh my gosh, I'm just gonna have to do I'm just gonna like do work and I need to like handle medicine and put in orders and like that is it. But reminding yourself that like these are human beings with like lives and interests and hobbies and passions. And so leaning into like, let me take an extra minute in a patient room and like learn more about what they like to do, or about and yes, that's correct. Learning more about what they like to do, or learning more about their hobbies or things that interest them. Like those can be really, really fun ways to connect and like make that human connection beyond just like work, intense moments, and just really kind of rehumanize yourself. So with that, I'm going to peel off. I hope I answered folks' questions, and it was really great connecting with all you all. Thanks for all the participation. And again, find me on Instagram if you want to chat more. Thanks, everyone.
So much. Thank you so much for coming.
Bye.
Talk more.
Thank you.
Okay. So very quickly, to wrap up this meeting, I do know it's 6 p.m., like 1 minute to 6 p.m. But if you like to earn an MOA point for this meeting, there we have a word of the day, and we will share the Google form in the chat. If this and the word of the day is ACL, which stands for anterior ligament. If you would like to earn any MOA points, please click the link in the chat and put ACL. Sign out with the word ACL.
I think pretty soon we're gonna make the MOA points spreadsheet public, so you guys can keep up with like how many points you have and stuff like that soon.
Yeah, this has been a project since last year, but we never really got through with it. But soon, probably by the next meeting or in spring quarter, we'll make our MOA points spreadsheet public. So you could see if you're an active member or not, because no one really knows if they're an active member, which we realize.
Oh yeah,
Um,
and active members get a certificate at our formal in-person event at the end of this year, hopefully.
oh yeah, so we're planning some of the benefits of being an active member is that if you're staying for a third year or not third year, another year at Dianza, you will have priority in being elected as an officer if you're interested in student leadership positions. Plus, you have a chance of being entered in a raffle to win a gift card, $10 gift card. Plus, you, as Nessa said, you will earn a certificate at this end of the year kind of like celebration, formal, whatever you call it, banquet. I don't know, but it's gonna be at the Ensis campus. We're currently planning it, and it's gonna be like just a fun time, just eating food, cake.
We're gonna
Eating food.
decorate cake. Yes, we're gonna decorate,
Yeah.
hopefully.
But yeah, the word is ACL, and the sign in and sign out form is in the chat. So after you sign out, you're feel free to leave, or if you have any questions, just ask us. Just unmute and ask. I'll stop my recording right now.